Hello, we are presenting the yes side of this debate. Our focus will be on the treatment and prevention of PTSD in soldiers using memory dampening drugs. This presentation will be given by Jordan, Karina, and Rachel. First, we need to define PTSD. Post-traumatic stress disorder, or PTSD, is a psychiatric disorder resulting from exposure to traumatic events. You may have heard it called shell shock or combat fatigue. It's usually associated with military personnel. Despite this fact, it is estimated that 1 in 11 people will be diagnosed with PTSD in their lifetime. So anyone is at risk to develop PTSD anytime. It's not limited to just soldiers. If 1 in 11 people are diagnosed, that's an estimated 30,226,336 people in the United States alone.
Side effects of PTSD. Some side effects of PTSD includes both psychological and social side effects. So some psychological are recurring memories of the trauma, nightmares, hopelessness, detachment, self-destructive behaviors, irritability, shame, suicidal ideation. And on the other hand, social side effects of post-traumatic stress disorder include difficulty maintaining relationships, avoiding places and people, lack of interest in historically engaging activities, such as someone who may have been an athlete before a trauma incident suddenly does not want to participate in exercise or that sport they were interested. The same as someone who maybe was interested in music starts to not listen to music, play music, just overall a lack of interest. Two more include poor sleep and attention, and social anxiety. Some current treatments for post-traumatic stress disorder include prolonged exposure therapy, also known as PE, teaches a person how to gain control by facing their negative feelings. It involves talking about your trauma with a professional and doing some of the things you avoided doing since the trauma occurred. A second is cognitive processing therapy, also known as CPT, teaches a person to rethink negative thoughts about their trauma. It involves talking with a professional as well about your negative thoughts and exercising short writing assignments. A third is eye movement desensitization and reprocessing, also known as EMDR, helps an individual learn to process their trauma and make sense of it. It involves calling the trauma to mind while paying attention to a back and forth movement or sound. What do these treatments look like? For example, prolonged exposure therapy is something as simple as describing or imagining the trauma out loud to a therapist, while a therapist could record and the therapist and patient can listen between sessions, that recording that they were just doing. And while they're listening between sessions, they can practice breathing techniques as well as processing their emotions to the trauma.
Next, before we move on, we need to define a memory dampening drug. Contrary to popular belief, memory dampening drugs don't erase your memories. They prevent short-term memories from moving into long-term storage, therefore affecting memory recall. The first drug approved for memory limiting is a drug called propanolol. Propanolol is a prescription medication. It's a beta blocker, typically used to treat high blood pressure. It helps reduce the workload on your heart, thereby regulating heartbeat and reducing tremors. Again, memory dampening drugs limit the amount of memories sent to long-term storage. They don't erase any memories. I think this is important to remember throughout this presentation.
How do memory dampening drugs differ from other treatments like the slide above? Unlike other treatments for post-traumatic stress disorder, as I described earlier in the above slide, memory dampening drugs work a bit different. Propanol is a memory dimming drug. It works by blocking the memory straightening chemicals in the brain. As a beta blocker molecule, propanol will help patients feel better sooner since it is lessening the recallability of the traumatic event. It is important to note that the semantic memory is not going to be affected because a lot of people, when they think about propanol, they think of a complete erasure, but that is not the case. Propanol is also effective in helping reduce negative emotions that come with PTSD that would be much more difficult to control without it. Overall, propanol allows the healing process to start sooner than later by giving people suffering with post-traumatic stress disorder a chance for some peace of mind. This is the opposite of what we see in the techniques from the previous slides because it is not directly facing the trauma at hand.
The opposing argument is that memory dampening drugs do more harm than good, so the benefits do not outweigh the risks. The opposing side of this debate focuses on the ethical and moral issues of using pharmaceutical medication to alter someone's brain or to eliminate or limit their memories. It posits that if we allow memories to be manipulated, an alternate humanity will emerge. We all know that our experiences shape who we become and our sense of self. Without those memories, even the painful ones, we lose our sense of self. There are many successful avenues of treatment for reducing the effects of PTSD that don't rely on altering our memories. Therefore, they are safer and more ethical. At any given time, there are roughly 1.3 million citizens serving in the United States military. Of those 1.3 million, 130,000 are directly involved in combat. 17% of those involved in combat tragically suffer lifelong PTSD. And remember, this is only soldiers, the percentage of soldiers suffering from PTSD, not to mention the percentage of the general population that could possibly be diagnosed with PTSD in their lifetime as well.
There are other types of psychopharmacology that are similar to brain dampening. Propanol, as mentioned in a previous slide, is a mind dampener, limiting the information that the brain reconsolidates after recall. Methylphenidioxymethamphetamine is different than the street drug ecstasy because in a controlled setting it is much safer and clean. MDMA can facilitate a reductional sense of fear that comes with the traumatic memory recall and possibly decreases the temptation to escape from difficult thoughts and feelings. MDMA helps adventure through the traumatic memories with a confident, clear, alert mind and discussing them with a counselor. Memories aren't infallible, and this methodology involves the ability to review them with an elevated burst of dopamine and oxytocin. This allows the patient to remember events in a new positive way. One veteran participant reported, "It allowed me to see my trauma without fear or hesitation." Recent research has been done on many other drugs such as dexamethasone, a glucocorticoid with minimal positive results in treating PTSD. Hydrocortisone has also been explored with null effects. Propanol is the most promising right now, with many successful trials on rodents and several studies on human participants with PTSD. There is significant success during human trial, double-blind research studies, with many of the veteran participants experiencing the memories with less emotional strife. There is much research on what has not worked, and it is relatively recent rediscovery of studying propanol and its effects on PTSD. MDMA research on memory revisiting is showing promising results in the lab as well, especially with long-term memories. Propanol is usually most effective with recent traumatic episodes. There are only a handful of studies using propranolol that are currently being done on veterans with PTSD. Many more studies are needed for successful replication. Another limitation is that mind-dampening medications are not effective when taken by themselves with no other protocol. This medicine is most effective as a regimen along with psychotherapy and healthy self-care routines. As with most medications used to treat mental health, trauma, and depression, it should be utilized along with therapy in order to prevent relapse and attempt to develop the necessary coping skills to live a well and healthy life. Thank you for watching this presentation on why memory dampening drugs are significantly important in helping to heal veterans across the world with PTSD. We would also like to say thank you to all of our veterans and their families.